Hey, welcome back to our Unclenched podcast. Today we're going to talk to Dr. Jennifer Hobson. With Dr. Jen, we'll be talking about a lot about breathing. And at the end of the podcast, we'll answer a couple questions from you guys, the listeners. But before we get started, I need to get caught up with Priya. What's going on, Priya? What's happening? Tell me more.
Yeah, well, it's been really fun because the kids have started basketball for their first season ever in basketball.
Oh my gosh.
Watching a bunch of little 7-year-old boys run around and try to figure out how to play has been epic. Like the first game, I think my son traveled the whole court with the ball without dribbling it once, but they don't call any penalties because they would just be calling penalties.
The whole time. Right.
It's just so cute, but he really likes it. And he wants to practice shooting hoops before school, like every morning.
Oh, wow.
It is the cutest thing ever. And then my daughter just runs around the court and she's smiling the whole time, but she's not really running with intention. She's just kind of prancing around. It's just cute. It's just fun and cute. And so that's what's been happening. And then of course work, you know how it goes. So yeah, what about you? Has there, how have you been? How's your family? And then is there a patient that's sort of been on your mind?
Sure. So I remember those basketball days, and I can remember my daughter in the 3rd grade playing, and she's like, her hands are up, she's guarding, and then she sees me and she's like, hi, Mom, waving to me, and then guarding again. But it's just funny. Enjoy those times because they go away too quick.
I know.
But speaking of her, she's still in Denver and doing her residency, and she's gonna venture out, and hopefully she's been talking to a couple doctors. I would like her to come back with me, but I told her, you've got to just learn more, see what you can do, see what you can learn, and what we do is so specialized. I want to make sure that's what she wants to do. I'm passionate about it. I love it. I can't imagine any other dentistry, but she has to kind of learn from someone else first, what she likes, what she doesn't like, and all that kind of stuff. And then come in and then realize, how great it is to work with Mom.
Yes, exactly. And she will.
We'll see. But I did have a patient, that came in this past week, and her name is Kelly, and we had got her, I think, in 4 months, all turned around, but she had been to 8 different practitioners. We counted them and what they told them and the medication. And she couldn't do things with her kids. She couldn't play with her kids or go on a hike with her kids or what have you. And she was a very active person, and everybody was just telling her, just learn to live with the pain. This is your new you. This is your life, And we were sitting there. She did a little video with me for my social, and she was crying, I was crying, because she just can't believe how good she feels and how normal she feels.
That's lovely.
It was a great just little session with her, and
good.
It was great. Any
how did you treat her?
That's the other thing.
I had to ask.
That's okay. I treated her using the T-scan.
Yes.
She was totally DTR.
Mm-hmm.
I had to do a buildup on one of her teeth to get her better guidance.
Like a canine?
Mm-hmm.
So totally. DTR is disclusion time reduction therapy for anyone that's listening.
Right. And we've talked about it all the time. And that is one of the tools in the toolbox that I go to. That's my first go-to if I can, and if they meet all the criteria. But
I've had enormous success with DTR too, but I've realized that patients that have a lot of dentin exposed are not good candidates.
Oh, no, of course not.
Yeah.
So I always, or flat teeth, flat teeth. That's too, you can't do that.
You can't do it. Yeah.
Agreed. How about you? You have any patients before we bring Jen on?
Yeah, I have a very lovely young girl. She's in college. Her name is Maya. She's hypermobile and her jaw locked closed. Again, this displacement without reduction. And she's been with the orthotics. We've gotten her unlocked. Her pain is gone. She's feeling so good. And she's just adorable. But she did have a little flare because she ate a bunch of popcorn chips.
Yeah,
Which
sure.
apparently are a thing. I don't know about popcorn chips, but she went nuts on popcorn chips, and then she's like, "Oh my gosh, the pain came back." I was like, "Maya, we talked about this. You're not supposed to eat stuff like that." So she'll get back on track, but she's still unlocked. Like, it didn't make her locked out. It just made her have some pain.
And at a certain time, she'll get back to eating things like
She
that
will.
too. Once she
She will.
heals in
Yeah.
her body, but it's not like a forever, but it's a time being. You just got to kind of.
Yeah, I think she just felt so good. She was excited. So she was like, I'm just going to eat it. And I was like, but she'll get back on track.
Yeah. Well, let's bring on Dr. Jennifer Hobson. She is of the Hobson Institute. And Dr. Jen, I met her, I don't know, within the last month at an ICMO study group in Chicago. And she was there and she had lectured to the doctors there, and a wealth of knowledge, this woman, the degrees, the certificates. I cannot even tell you, like, I could have listened to her for 3 days. Honestly, she's a PT. She's a certified myofunctional therapist and posture manual therapy, cranial facial therapy. She did dry needling on me.
Nice.
Oh, that's right. I forgot.
Yeah. Buteyko breathing method, and Laney restorative breathing method. So welcome, Dr. Jen.
And thank you, Priya. Thank you, Alex. This is I love doing these types of things and really just sharing what I know with people that are interested in this field. So I'm excited to be here. Thank you for the opportunity.
And I could so tell that, like, when you were lecturing, like, just your mannerisms and your, like, how you breathe and how you were standing and how you were doing everything. They're like, oh my God, this woman just is so full of a lot of energy and a ton of knowledge.
Thank you.
Yes. Well, hello and welcome, Dr. Jen. Before we get started, I'd like to know about your journey and how you became interested in breathing, tongue positioning, all the modalities that are connected. Like, tell us your story.
Well, it started with, like, when I first came to Chicago, I started my journey after I'm from DC area. So I started there for a year and I came to Chicago and started my journey around craniofacial therapy. So during the time of my clinical residency, I did the first clinical residency in Chicago, and my boss at the time was my mentor. He said, let's do a clinical residency, and we needed a didactic portion. So I had started to do work with manual therapy. It's kind of like being a chiropractor and doing all the joints, understanding the body from head to toe and how all the joints moved and rolled and glided it. And I did it in a university called the University of St. Augustine, where Mariano Raccabato was teaching through. So he's the guru of all gurus for TMJ.
Yes.
And, like, he teaches dentists how to look at the body and the bite, the occlusion, from the back of the head forward. So thinking like, okay, if you are in this forward head posture and you tap your teeth together, your jaw is in a retruded position because of the length of the muscles and the tension. When muscles get lengthened, they will start to pull the bones together because it doesn't want to be lengthened. So the joint of the jaw is very dependent on head and neck posture. Right. So I started taking all of his work to get to actually earn my doctorate. So I ended up getting my doctorate through craniofacial therapy and Raccabato's work. And I had been doing that for a while, getting people out of pain, working on head and neck posture, manual work to the muscles and the joints to make sure that they're aligned right, dry needling, which Alex has experienced, a little painful, but it eliminates muscle, the trigger points. The trigger points have chemicals that cause the muscle to knot up and not circulate blood well, and it weakens and tightens the muscle. So all of that I've been doing to get people out of pain and headaches. Then, and like right when I started having kids, your kids start to teach you a lot. And my kids taught me that there was a problem with their breathing because they somehow had adenoids and tonsils that needed to be cut out. And I'm like, what happened? You know,
Right.
my daughter would wake up kind of on her car seat with her head cocked over and start having like a wailing event. And I'm like, wow, she's a drama queen. And I'm like, now that I know about airway, now she was very uncomfortable, suffocating a bit. But I had no idea. I didn't know she had tonsils and adenoids that were swollen, and she was a mouth breather. So I went to all these docs, and the ENT's like, I'll cut them out next week. And I'm like, why are they swollen? So I ended up doing allergy testing and that whole thing. One of them was allergic to everything under the sun because he was a premature baby, and the other one wasn't. So I knew it wasn't that only. And I went to my first sleep apnea conference through the AAPMD. It's a group that is like multidisciplinary airway. It's a very good group. And I learned about what a myofunctional therapist does. And I look in people's mouths with flashlights all the time. And I'm like, what are you looking for? So all these aha moments happen because I know a lot about this area, but I didn't know the tongue. I didn't really understand how wide everything should be and how forward everything should be and how worn down the teeth, what that meant exactly. So I just had a lot of aha moments. When you become a myofunctional therapist, you start learning about breathing and buteyko. So that whole journey started because of my kids. And then I realized I was tongue-tied. They were tongue-tied. I have a deviated septum. They pulled my bicuspids out, like all of these things. I'm like, wow, okay. So I'm a breathing patient too.
Yeah.
So it's really been a long journey, and it's not over. Like once you know a lot and then you want to know more, then you start realizing you don't know that much and that you want to keep learning. Wow. So that's where I'm at right now. I love it. I love it. And if you can tell, I'm very passionate about it, and I'm teaching it now. So I teach stuff that I've been gathering from other professions to try to change the way we look at health and, physicals. And so I'm excited that at least there's a platform like this for sharing and people that are interested. So thank you.
Oh, you're welcome. And I had the pleasure of taking a class from Rockabato too.
Oh, yes.
And I did. And when he was in Parkersburg, West Virginia, he'd come there, like once a year or something like that. And then I came back and I told my PT, you need to take this. And he put me off for a couple years. And then finally I said, you don't take this. I'm changing PTs because I need them to learn. So is Rockabato still teaching that?
Yes. Yeah.
He is.
Okay, he was here last week in Chicago. I had a big party for him at my clinic. Like I've been collaborating with him since 2004. So I started taking his work, and I was like, so can I come train with you? And he's like, take all my courses. So in 2004, I finished his courses, and I've been going every year to train with him in January. So I learn anytime you're around that man, you just absorb more,
Right.
And he was here last week for, it was an AES meeting, the Equilibration Society meeting. I forget what exactly. You should know. You're the dentist, but he was here, and he sends me things from Mongolia teaching. He teaches all over. He's not done. The man is never going to retire.
Good for him.
Good for him.
So,
well, tell me and our viewers about, like, I know you kind of touched on it, forward head posture and breathing. And can you explain what happens, like how that forward head posture is connected to breathing so people can sort of put it together?
Yes. So I don't know if everybody listens to this, but if you watch a video, you'll get it. But I'll kind of explain what happens. So many people have forward head postures, and they end up craning their neck to help open up their throat. And the throat, you don't realize it, just a little posterior rotation of your head on your neck opens up your airway. So, but it helps your breathing, but it doesn't help your neck, and it doesn't help the tension in the neck. So that part of it is a compensatory position to help open your mouth, your throat up. But what I teach, because a lot of people have an issue with their nose, including myself. And by the way, I had no idea I was a mouth breather until my kids were 3 and 5. Like so what is that? That I was 40. That's when I learned that I was a mouth breather. And I'm not going to tell you how old I am now, but it's been a journey. That's why I'd say I'm a breathing patient too. So people think that they breathe just fine. And the majority of people overbreathe. And what that means is that you breathe too much all day. It's very shallow at times, especially if you're an anxious person or a nervous person or a go, like type A. I see a lot of those in Chicago. My downtown office is a lot of executives, and they're just go. So that makes your nervous system stay in fight or flight. You end up like being in that sympathetic nervous system that makes you breathe that way. And guess what? If you breathe 24 hours, that pattern, and I tell this to people that have had a car accident or a major breakup, like a divorce, that you're miserable and just terribly feeling terrible inside, your breathing becomes the first thing to go. And then when you become a rapid breather, you start to get used to big volume breathing, meaning that we're supposed to breathe 6 liters of air per minute. The majority of people that come in are breathing 3 to 4 times that volume.
Whoa. Wow.
So they end up yawning a lot, sighing a lot, huffing and puffing, like you can hear them crossing, going down the hall, or if you ever go into an elevator and you hear these people, once you know it, you can't stop seeing it everywhere. So just know that it's an undetected problem that 95% of us have. Children are not immune to it because they're young. The foods we eat make us, first of all, the preservatives make us breathe more. Everything that we eat that's basically softer than eating from the land and eating off your farm, like that's not happening anymore. Everything's packaged. Everything's easy and mushy. We even squirt things in babies' mouths. We should let their jaws develop from natural weaning with gnawing on your carrot that, you got to supervise them, but you got to let them explore and grow their mandibles and their jaws. But yeah, it's, to me, the book, James Nestor did a great job with that book, Breath. It brought it to the forefront that people actually realize. And like, I'm getting people, I read the book Breath. I'm like, great. That's what we're going to learn in my clinic. We're the functional PTs.
Yeah.
We're the PTs that are going to make your body support what you need to be successful and thrive for life. Really, that's what my goal is. Yeah, I can get people out of pain, but I want them strong so they don't need us anymore.
Yeah.
Right. So when you were lecturing at ICMO at the study club, you spoke about airway instability associated with clenching and snoring. So how can you explain how that is relating? So the airway instability and the clenching and the snoring.
So, okay. Airway instability, and maybe I'll later send you a little image you can put up, because
absolutely.
I think when you understand what our tongue is supposed to do on our mouth, what's lazy about our mouth is the back of the tongue. The back of the tongue. Like as we get older, things start to go south because of gravity. And one of the things is our throats, and our throats start to fall down. The farther low, if you open your mouth, and everybody can do this, you get your phone out, you look in your mouth, you get your selfie out, and you look at your throat. Can you see the airway? If you can't see the airway and you just see a wall of soft tissue, you're in trouble.
Wait, so I'm just opening really wide? Am I saying, am I sticking my tongue out?
First, just look in there. Can you see a hole? It's that simple. Can you see a hole?
Okay.
Yes.
Okay, good. Stick it out, and can you still see the hole?
Uh-huh. Yeah.
You want to see under that uvula, Priya. You want to see under that uvula, and what supports the throat from falling down is the back of the tongue.
Yeah.
So try this. I want you to just cluck. So you're going to all close your mouth and create a suction, and just like that. Yes. So that now you understand suction. You can tell that you create a negative vacuum that releases and there's a sound. Now I want you to close your mouth. Say the letter N. So it goes right, that tongue goes right to the N spot. Then close your mouth. So you're doing N, mouth closed. Now I want you to swallow. If you swallow, this happens. The back of the tongue creates a seal with the back of the soft palate. That seal is what stabilizes your airway from being floppy at night. I tell people, don't sleep on your back. With gravity, your tongue it'll go back there. You want to create that seal and train that vacuum. You can train it, and it's all research-based. There's an ENT from Germany, Göttingen, the University of Göttingen, this ENT named Wilfred Engelke. He has created the vacuum activator. It's an up locker, a little tool that you can train your suction. So any snorer, anyone that snores or has sleep apnea, that you can actually train what the tongue's supposed to do to support and not collapse at night. And it reduces snoring and it reduces clenching. It stabilizes that part that likes to fall down, that gets floppy. So if you can create a seal and create a negative vacuum so that your tongue is like suspended like a suction cup. I call it the mouth suction cup is your tongue. It shouldn't be an active thing because you're going to be passed out sleeping. You need to create a negative vacuum, train it, because it's not like a one and done. Because this little up locker, and Alex, you have one.
Yeah.
So that up locker, it goes in your mouth. There's a little tube that connects with the funnel. The funnel tells you if you're in suction. So when you hold it, you watch a movie, you're in suction, and the majority of people lose suction after a minute. And then they're like, their mouth is closed, but they're lazy back there. But you know, if it's pudgy, that funnel, you're not in suction. So you have to end mouth closed swallow to create that suction again. And it comes back and you train that endurance. And it can't just be a little bit. Like people say, oh, I know how to do it. I know how to do it. You need to train 30 minutes a day. For a couple months, things change. There's a lot of that.
With that up blocker, is there a way, if somebody should buy the up blocker from you, is there a video that you have on how to use? I mean, you explained it
Absolutely.
to us.
And there's
okay. Because I think that'd be good for us to put out there too, because when I was doing it with you, I was sometimes sucking in too much.
Yeah. So what I do in my office, and some people want to buy the manometer. The manometer is a suction measuring tool. It's a pressure tool, like basically, and a manometer is to measure the air pressure in your car tire. Same thing. So you connect this up blocker to a manometer, and it's a minus 15 millibar of negative vacuum pressure. It's research. It's been researched in the literature 2 times. This Wilfred Engelke went back and did all the research and compared it to what they've learned back in the late 1800s, 1873, with the Dr. Donders, who originally measured it. So it's the same measurement. You need a negative 15. So when I tell people, you put it in your mouth, you end mouth close swallow, that funnel should not be sucked in strong, like probably what you were doing, Alex.
Overachiever.
You are. The pudgy is no suction. So you can be like hanging out and like having your tongue down and no suction, and the funnel is pudgy. Now, when it's correct, It's just slightly in.
Right.
And it's
right.
so that's what I'm looking for. I measure everybody that comes in with them in my clinic, but you don't necessarily need that. You can train it. And I really tell people, I'm like, it's consistency. Everything in life, you get better if you present the brain with the activity that you want it to become normal. It has to be at least a period of time for every day, for a period of time, or else nothing changes. So I do think I've been a myofunctional therapist for years. This is a game changer. This has changed all of what I do. And I use this as a tool to know if the back door of the tongue is closed.
Interesting. Yeah. Well, how about a plugged nose? I know James Nestor wrote about it in his book, Breath. Can you explain what happens with mouth breathing, especially in kids as they're growing?
Yeah. So I can tell you as someone that personally went through a mouth breathing situation, you end up with a high. If your nose doesn't work, where are you going to breathe? You're going to breathe through your mouth. And is that back door going to be closed in your tongue with the soft palate if your mouth is open breathing? No, you lose all that. So what does the tongue do in the oral cavity? Your tongue, as you're growing from an infant's head to an adult head, every swallow, if it's done right, brings the midface forward and expands the nose, and the palate is the floor of the nose. So it's going to expand that. So if your tongue is low because you're letting the air go over it to breathe, none of that happens. It happens irregularly, and you become a very narrow. You want about 40 millimeters of width between your first molars. If you can't get 40 millimeters, or 38 is like the right amount, you can't fit a tongue, so the tongue ends up laying low. Everything lays low. So that palate, instead of it being round like this, like more of an arc, it becomes high and then more like a V-shaped. And that V shape goes into what? Your nose. So your nose ends up bending. So I had a deviated septum that was blocking this right sinus. Oh my God. I had a layer of gunk here that I didn't realize. I wasn't sick with that CBCT. It was just, I wasn't aerating that side because it was blocked. And so I ended up getting a deviated septum surgery, turbinate reduction. It was better, but I'm still scrunched. I'm one of those long face people. And I've got 4 bicuspids out and third molar. I have 8 teeth out of my mouth that were healthy. And now I'm smaller. So I'm stuck with what I have. But because of what I've been teaching to my patients, training, I constantly am doing Buteyko, which is when you're a mouth breather, you breathe too much volume. You get used to big volume breathing. You yawn a lot, you sigh a lot, you snore. A lot of people snore when they end up mouth breathing for too long. So your nose starts to bend, your palate gets high and narrow, your teeth starts to crowd, your neck cranes, your rib cage elevates. You breathe through your neck and your chest. It's awful. Everything. It's a slow progression. It's a little sneaky.
Wait, I had a patient. She was probably like early 40s, 40, 41. And same thing, bicuspid extraction, deviated septum, poor breather. But I did orthodontics on her. And I expanded her a little bit. And then what happened was the floor of the mouth became broader.
Yeah.
So, I mean, the roof of the mouth. And when the roof of the mouth came down, and I have x-rays to show it, her septum straightened back up.
What?
That's amazing. How old was she?
She was like 40, 41.
Wow.
So you take that
right
that ceiling down,
yeah,
and it spreads it open.
Right. Yeah. But she was a good student too, because she did myofunctional therapy, she did breathing, and not like a Buteyko or anything like that, just like on what I could kind of coach her on, and with lip seal and tongue positioning and things like that. And we did a tongue release on her too. And she's like, oh my gosh. Cause when I showed her before and after, CBCT scan, she's like, my deviated septum's not hardly there anymore. It was still a little bit, but it was, and I'm like, I get it. I mean, it was just like oh my gosh. So now I'm starting to pay a little bit more attention when I take before and afters to see like, okay. And a lot of cases, it's so much improved.
That's wonderful. See, the power of a dentist. A dentist can really, really help, and dentists can really hurt patients sometimes. It depends on the knowledge of the dentist and the tools of the dentist and how they understand. Airway to me is like everything adapts around that, but not all dentists know about the airway, and they're very good at teeth, and cavities and all, crowns. But when you understand what you're doing, and you all have the power to change so much in the mouth with your tools. So that's why, I mean, the majority of doctors that send to me are dentists, and they understand. I just try to support what they're doing with the function of the body, so that you create the architecture and I create the function that supports it. That's really what a beautiful thing when you have both of those
modality
parts of the picture.
Yeah.
Yes.
Yeah.
Yes.
Of course.
How can parents check if a kid is breathing through their nose or their mouth?
Oh gosh. Well, I'm guilty. I had 2 kids that were mouth breathing, had no idea. And I'm in the field. So it's really like, you think that your kid's fine, and you really have to pay attention. So are they boogery, right? Are they, do you have little ones
congested
that are
all the time?
Always congested, always congested. Do they snore at night? Prop every night until you are sure. Go and check your child's mouth. Yes. Is it propped open? Any amount of opening, they're going to be mouth breathing. So,
well, I was going to show you this picture. I'm sorry to interrupt you.
No.
This is after my son was born, and I didn't have this knowledge yet. But every picture, his mouth is open. I know, he's adorable. I love it.
So cute.
He's so cute. But every picture, and then once I had the knowledge, I started being a complete creeper and like going in and watching them sleep. And always their lips were apart. Always. Yes. And so now they have these appliances that they wear that help, but they're also open to using just a little strip of mouth tape, just a little.
Absolutely.
Yeah. And it's helped them immensely. And then we've also treated their chronic allergies with sublingual immunotherapy drops. And
Great.
So they're not constantly congested anymore. So, gosh, I still feel guilty to this day because I didn't have all my knowledge until my son was maybe like 6 months old. So I missed the window of nursing. They were both tongue-tied. I'm tongue-tied. I had 4 bicuspids extracted, but I didn't know. You don't know what you don't know.
I know. And both my kids, my daughter started at 5 taping. And guess what? Her tonsils and adenoids went away. They did not need surgery. So I had a really dear Lori Frey is my guardian angel. And she's a myofunctional therapist that traveled an hour and a half to see me for free to help me with my children. And she said, Jenny, if you want those tonsils and adenoids to go down, you need to keep their mouth closed at least at night when they're sleeping. And I'm like, so my husband thought I was crazy trying this. And they only had 3M micropore tape at the time. They didn't have all these fancy tapes that go around the mouth. So I did it. My son couldn't at 3. It was like he's still dealing with some airway issues. My daughter's great right now. She taped for about 3 years. And he ended up being able to tape, and he still tapes now. My son still tapes. Mm-hmm. So taping it's not going to work for everybody. Some people can't tape right away. And you will know, your body will wake you up and it's like, oh, you can't, you either suffocating or you're taking it off you because you can't deal with it. But if you're not that much of an overbreather, not that much of that volume breathing that I was saying, that when you mouth breathe, some people are extremely overbreathers. And the sleep apneics, they try taping right away and they're like, I can't, or they get anxious. That's not a forever thing. They need to train their breathing. They need to train their volume. We call it reduced volume breathing. It's all Buteyko. I do that online. I do that for many people to get them to stop yawning, snoring, and
you
basically
do it online. Where do you practice? Like, where are you physically located?
I'm in Chicago. It's called the Hobson Institute. Chicago, like downtown Chicago, then Lincoln Park and Park Ridge, which is another suburb. Yeah.
Cool. Good. So what one thing too, I think with the kids and knowing like if they're a mouth breather is I always ask the parents too, are they like a sloppy eater?
Oh my gosh, my son. We would find rice in his diaper.
No,
rice.
Even just like always smacking their lips. You always hear parents saying, keep your mouth closed, but they can't breathe when they're chewing with their mouth closed. So they got to open their mouth. And and parents just think they're not, they don't have good manners.
And they are struggling, right? So I teach a lot of parents to use drops of Afrin and then oil to kind of coat, like just to get the nose unplugged. You can't use Afrin for too long, 3 days in a row, but you need to help the nose. Like we're treating everything but the nose sometimes, and the nose is the problem. You got to get the nose to unplug. You were saying, what about the plugging the nose? You can do breath holding exercises to unplug that builds up CO2 and nitric oxide. Those two things, if you have nasal breathing and you do breath holds, it opens up your nasal passages. So you can start the process of starting to get the air to flow through the swollen turbinates, and they start to deswell. If you don't use your nose ever, it just stays stiff, like stuffy and congested. So you have to create that passage. So I do that. And you remember Gopex counting and chewing. Do you remember? So it's all like practicing after you do the Afrin, chew with your mouth closed, soft lips together, chew on both sides 20 times, alternating. Don't just chew on one side. And then I talk about the invisible swallow. Remember you pause after you create a bolus, you keep it in the middle of the tongue, and you look at my lips, look at my throat. You don't move this at all. It's invisible because you don't move it. I'll point when I'm doing it. 2-second pause. And there's so many kids and adults that are the crane and the grimace and so it's a lot. There's a lot of components, and it's just like I'm teaching them how to blow their nose. A lot of times kids don't know how to blow their nose.
Yes, my son could not figure it out.
You got to teach them. It's not like common knowledge. These kids need to learn everything.
Teach him. He couldn't do it.
Yeah. So that, and then you got to teach them how to chew, how to create a ball, how to swallow without tension, how to sit. Do you know how many kids are like
oh yeah.
Oh my gosh. They aren't, the teachers are not saying sit up. They're not
at all.
You see, they got 25 students. They're dealing with as much as they can.
Sure.
So I've been helping, and it's like an epidemic. It's an epidemic of mouth breathing, slouching little ones that are growing into bodies that are just about to start snoring. And it's sad, but more people are learning this. And I'm appreciative of you and Priya that really understand this and are doing their part. But we need to grow this field and awareness.
We do. And I think one of the problems is in dental school, they just teach you to look inside the mouth and treat what you see. So then all of these doctors graduate, and that's why most dentists do tooth by tooth dentistry, and they don't really think of how the tongue is attached or what's happening when you swallow. I mean, maybe they'll have one lecture, but I know I never did, but I went to school a long time ago. So it's a matter of like saying, okay, when you go to the waiting room, You can't just tell a person, I'm going to take your head back and work on you, and your body's going to stay out here. Like, it comes together. So why common sense are we not putting this together and why is academia not helping us to get with the times?
Well, and especially like with orthodontists, it's like they're still teaching ortho the way it was done in like the 1950s. Like they really haven't
right.
They still,
some around me are starting to be like a little more airway centered.
Yeah, I've seen airway centered, but I've also seen orthodontists just deny that there's a connection between the bite and TMJ problems.
Oh, yeah.
Yeah. So it's like, you can't be airway centered and believe that, right? Like it all goes together. And so,
so talking about that, what about the link of a balanced bite and pelvic stability? Like, you talk about the study that you did with the late Ira Shapiro.
Yes, my sweet Ira. He was one of my go-tos for anything. He was such a good mind, curious, and nothing was impossible. He was going to help. So Ira this is a story about Ira. He called me one day and said, Jenny, I got a proposal for you. And I'm like, what do you need, Ira? And he's like, I need you to do a study. I see this every day. I've been doing this for years. And every person that comes through my door for TMD or sleep problems, I check their hips. I check to see if their hips are even. So it's basically on top of the hip, the pelvis. And the majority of people have one hip high, one hip low. Mm-hmm. I put an aqualizer, which was it's one of those little, it's like a plastically appliance that has fluid that sits right between the back molars.
Sterilized water. Yeah.
The fluid like travels from the front to the right to the left. So anywhere there's an imbalance, one side higher, one side lower, that fluid will fill in more on the side that needs more fluid. And the side that's closer with the teeth doesn't have as much. So it balances out your bite, artificially, but with that thing in.
Right.
And you walk 3 minutes. This is what I did. I didn't have stairs. He has stairs right next to his office, but I would walk 3 minutes on the treadmill, recheck them. 80% of the people in this 30 person study improved. 80%.
Wow.
Without touching them, without redoing my balancing of the pelvis.
Sure.
PTs do a lot of pelvis stuff and muscle energy to get the hips even.
Yeah.
Which means that the occlusion, the way that your teeth meet, creates a descending effect on the spine.
Yes.
So it's an easy way for you as a dentist to test it. Yeah. If the pelvis evens out, it's an occlusal problem because you've balanced the occlusion. Now it's up to you as the dentist to figure out how to get the teeth to meet like that without it in. But I always tell people, walk with it for a half an hour, go outside, take a walk. It's kind of a nice device that also tells you whether or not you're starting to clench, because the pressure of the back, those pockets will make you feel like, oh, I'm starting to clench, relax. So I use that for my clenchers. I also do my up blocker suction training because that stability will reduce the clenching as well. So to me, it's kind of a diagnostic tool that any dentist and PT can use.
Sure.
The PTs know when to send to the dentist now. Now, if it doesn't change at all, then you send it to the PT because they've got a pelvic issue that needs to be addressed by PT.
I love that.
You know whether or not it's coming from the mouth or not.
Right.
Well, I want to get back to the airway a little bit. Can you explain how airway instability becomes muscle dysfunction or leads to?
Oh, yeah. So when your airway is unstable, the back of the tongue isn't supporting the soft palate, that part drops because you're mouth breathing and you're congested. So what ends up happening, it changes the game. Your muscles that you're supposed to use to breathe are not the same. You end up using, if you can believe this, you use your neck to breathe, your scalenes, which are a group of muscles that are in the neck that connect to the ribs. Every breath you take, they elevate. So you end up having your rib cage high. So some people, they feel like their ears are, their shoulders are up next to their ears and their neck is tight. Their chest, your pec minor, your pec muscles, you end up using upper traps to breathe, not your diaphragm like you should. Now, if you look at, I don't know if you can see this, but I want the rib cage to be in a dome. A dome creates, the ribs can create that domed position, but my mouth breathers are all like this, high. And they use this to breathe, and their diaphragm doesn't work well in that position. Your diaphragm will only move this much. It's little. But if you're domed and you're here, your diaphragm moves this much, and these muscles aren't needed, right? Because your nose is working. So it's a matter of understanding what changes in the body when you start to use your mouth. Your neck starts to work when it shouldn't, all day, all night, all day. So I have people laying on my treatment table with their head supported and their neck is like this. And I'm like, oh my gosh, I can needle them. I can massage them. I can stretch them. They'll come back the next time the same way.
Right.
So you need to learn how to seal this, dome the diaphragm, lower it, get this dome to happen, relax the neck, breathe through your nose, swallow without tension, and position yourself in that alignment so your muscles aren't working heavy and hard to hold your body up.
That's like so much to think about. And you just think like you shouldn't have to think about this, but you do. In order to for your body to function properly, and that the oxygen and the nitrous oxide and the carbon dioxide and all that stuff and the cells getting properly nutried. I mean, it's just a lot.
It is.
It's a lot.
It is.
Yeah.
It is.
But you also spoke about postural cascade of the airway instability. And explain what you mean and what's going on. And I think we hit a little bit here and there on that, but explain about that.
Yeah. So there was one picture that I showed of my daughter and like a similar picture of a research, like a diagram of a child with the mouth breathing. So think of the average child. The head is forward and their shoulders are winging. Their shoulder blades are kind of sticking out because they're all on tablets and phones, and like they're not climbing trees and like, my kids now swim, which is a really good thing because it's a reciprocal movement and you'll strengthen your shoulders. But we all kind of get weak and narrow here. But the head kind of does that crane thing. Your sternum and your rib cage elevate. Your rib cage goes into what we call an inhalated position. It's like an overinflated position, high. Your back, your lower back, it arches too much. So you have what we call excessive lordosis, where you're like you're sticking out your back, your buttock, and your tummy sticking out. So there's like no connection of the upper quarter and the lower quarter because your abs are off. So the cascade of things is your abs aren't working to connect your upper and lower quarters, so you can easily strain. You can easily strain your back. And once that happens, your rib cage starts to elevate because there's no connection. Sure. Your chest and your neck muscles start to elevate the rib cage even more. You've got the cranial nerves all sit in the back of the neck right here, the base of the skull. You're compressing them. So you're all the nerves, the cranial nerves that do automatic function, breathing, swallowing, balance, all those things that are naturally happening, they're happening under compression. So the base of your skull is just sitting on them. So that everything changes if you can create suction. If you can create that uplock position, you will change your airway and you'll start changing your head posture. Your nose starts to work. The correct muscles start to work. And then you stop pulling on your chest to elevate. You can reverse all of it. And it's not It's not as hard as what you think, because I do get people to think about what they're doing to break their cycles, their patterns. People are in bad patterns of use of body. So if you can tell them what's proper and get them to train the suction, things start to feel better. And then when people start feeling better, they're like, I'm going to listen to her. She's making me have more energy. I have less tension. Okay. I'm going to do more of it. So it's like a slow, none of it is like quick. I wish it was. It's not.
Sure.
It's like 3 months of treatment is really, I make people transform a lot. They're not perfect at 3 months, but they're very much changed.
That's so neat. Well, throughout this, we've been talking about Buteyko breathing. For someone who doesn't know what that is, can you explain exactly what is that and like how it's done?
Yeah, Buteyko is Dr. Buteyko was actually Ukrainian doctor who went to medical school in Russia and figured out that he did a research project on volume and how often the worse the people came into the hospital for different diagnoses, the worse the diagnoses, the more they would be breathing, the faster they'd be breathing, the more volume. So he measured volume in these different types of diagnoses. And basically, it's true. The sicker you are, the more you breathe. And so we all need a breathing diet. And I know that sounds really weird. People are like, what? You're telling me not to breathe? Like, what? I'm not saying don't breathe. I'm saying don't breathe 30 times a minute. Let's breathe 10. Do you know what I'm saying? Like, let's not need that much breathing. Let's breathe 10. Let's reduce 2/3 of what you're doing. You only need that 1/3. It doesn't make your oxygen saturation more. You have enough oxygen. So Buteyko's on the premise of the Bohr effect curve. The Bohr effect curve is as you breathe in oxygen, it binds to hemoglobin. That hemoglobin oxygen bond, it is so tight. And when CO2 is below 40 millimeters of mercury, and my mouth breathers are in the 30s or in the 20s, it doesn't allow that bond to detach and circulate and distribute the oxygen. So the oxygen is in your body, but it's not distributed. It's not going through the tissues like you want it to. So that's the problem. It's like people think, and then they think, I need to breathe. And they're winded. They're easily winded. These are the people that they dive in the pool. They need to get up right away because they need air. It's who's the better breather? The one that can swim underwater the entire length and come up and then take the breath. Or the one that's like, I need to breathe. And then they need to breathe more. Do you think breathing more is the answer? It's not.
It's not.
They actually need to breathe less to balance out their CO2 levels. But guess what? It makes you feel winded and anxious. So it's hard to do without someone that understands this, that guides them through it. Because people don't want to be uncomfortable because they think it's wrong. But the only way to change that overbreathing pattern is to breathe less and to get used to less volume and less need for air. That's the Buteyko. It's a lot of, I learned how to breathe right. You put my breathe right on. I put tape on. It has nothing to do with suction. That's another thing. But it's the volume of breath, how often you breathe. I always have people like put a finger under their nose. Feel how often you're breathing. There's some people that breathe this fast.
No.
And they don't know it until they start feeling it on their finger. But I have a capnometer that measures everything that doesn't lie. And when they say, oh, I have no problem breathing, I'm like, do you see you're breathing this 3 times the volume and your CO2 is half of what it should be? Oh my gosh, I didn't know that. So my capnometer is very important to me. I can't, you can test the breath hold, and the lower the breath hold, the worse they are. You want to do a breath hold at least more than 20. But if you're at like 5 seconds, 10 seconds that you can only hold your breath, you have an overbreathing problem. You need to do Buteyko. You need a trainer to help you.
Yeah, I think I was, when we did that in class, I think I was on the lower end. And I'm like, oh my gosh. I had to come up for air. It felt like kind of like, maybe 16 seconds or something like that. And I'm like, that's not very good.
I started at 10. And now I can get to 60. I can. So like it's trainable, and
so this is time. Holding your breath for 60 seconds.
Yeah.
Okay.
And
so do that little exercise we did in class, like how you told us to, do that. So and we
this one, the cupping or this one?
I think it was the cupping. We did.
Okay. So CO2 when it's low, and I always have a stick. I don't have my Starbucks stick here, but like if you think about having a Starbucks stick, those little green sticks, you put it under the tongue to elevate the tongue. So I always start with that. If you cup around your face, you breathe in, pause at the top, you exhale strongly through your nose. So you feel the warmth. That warmth tells you that you are breathing too heavy. That just means too heavy. Now I want you to breathe in. Priya, you're doing it great. Breathe in gently. Pause at the top. Exhale so light, so soft that you can't feel it on your hands. It's a gentler exhale. It's not as big a volume. Inhale lightly, light, gentle. Your tongue is up on the palate with the light suction. Pause at the top. Exhale so light, so gentle. Pause at the bottom. Now the next one I want you to do is breathe in gentle. Pause at the top. I want you to hum. Just hum gently. Now at the end of the hum, I do a little baby swallow if you can. Gentle breath in again. Pause at the top. Hum. So the humming causes that vagus nerve to engage. That vibration activates that nerve. That calms down all your organs. It gets it out of fight or flight. Gently breathe in.
My daughter's always humming.
That's excellent. That's an excellent thing. That's a good habit. Good habit. Good habit, daughter. So you're humming. So my CO2, so I have the capnometer going and I show them what they're doing. And so instead of them being way below the line, like rapidly breathing, they start to do this. They start hitting the line at 35. 35 is the low end of normal. And then when they hum, they start to get past the line. They're like, oh. So that's what you want. You want to go over that line.
And what is it measuring again for our viewers?
Yeah. So two things. Capno trainers measure CO2 levels in millimeters of mercury and breath rate. So those two things really tell me a lot about a patient.
Interesting. I'm going to try to start incorporating that. That's really neat.
Yes.
Mm-hmm. Well, Jenny, thank you for being here with us today. I think we could go on and talk again. We might have to have you back to do that.
I would love it. Anytime.
But we always get a couple questions from our listeners. So I want you to help us answer these. And the first question was, my son can't keep his mouth closed when sleeping and he snores. Oh. What do I do to get him to stop snoring?
Okay. So it is basically he needs breathing and airway treatment. So I would say I would invest in Breathe Right strips for children. Okay. So Breathe Right is a little sticker that clean the nose because the little ones have oily noses and they won't stick. So you want to put a little alcohol here, clean out their nose, put the sticker here to like elevate. It just kind of opens up the nose from inside. It lifts the walls of the nose up. So it creates more patency in the nasal cavity. You want to do that. You want to get a beginner kit, up blocker beginner kit. That's at forwarddonics.com.
Okay.
And I do give I'll give you the code. It's capitals for a discount code of 10% off. You can do Hobson Institute 10 and it gives you 10% off. I don't think you can stop snoring without the up blocker training.
Okay.
I don't think you can stop snoring without because that's what seals the back door of the mouth. The back door is the throat and the soft palate. So that I think you would need to do. You could find someone like me in your area. It's sometimes hard to find, but you need to start training the child to understand how to reduce their volume. That's.
But you do your training too via Zoom, right?
I do. I absolutely do.
They don't have to live by you. They can just come and sign up with you.
Yep. And I do children, adults. I have an online breathing retraining program that is $99, and they can do it if they're an adult. They can do it, and they can learn it and try to implement it with their child if money's an issue. Like my pearls are in that program, and then some people do that, and then they supplement with me coming in once a month or once every other week. Like it's whatever they want to do. And I can share with you that link.
We'll put all that stuff up at the end. We'll get that, get all your info and your contact.
I had one child that was snoring.
Mm-hmm.
And so I know what that means and how important it is. And believe me, it's not easy. So you need someone to guide you through it. Mm-hmm. And I coach people. I tell parents, I'm like, I'm the coach. You're the trainer. You're with your child all the time. Seeing me once in a blue moon and not doing any of the work is not going to change anything. I will help you. I will help you, but you've got to help your child. You're going to heal your child. You, not me.
Right.
Yeah.
Right.
Yeah. Well, second question. My son was, someone wrote, my son was diagnosed with ADHD. Someone told me it is because he does not breathe well, and he is a very loud, chompy chewer. Is this possibly related?
Ooh. So we talked about the sloppy eating.
Mm-hmm.
Sloppy eating normally means mouth breathing while you eat. So mouth breathers tend to have issues with anxiety and ADHD. So
see that.
CO2 levels are very common in ADHD to be low. So what is low CO2 makes you tight, makes your smooth muscles around all of your organs tight. So it for me, when my CO2 was low, I had IBS. for CO2, when your CO2 is low, it makes you a little anxious. So it makes you irritable and anxious and not feeling comfortable in your own body. So for me, ADHD, if they haven't had a breathing assessment, they might be missing a big root problem that they didn't know was the actual cause. So I think breathing is a problem.
If you've seen patients with ADHD, do you see it change after the breathing is addressed?
Oh yeah. Oh yeah. Like focus occurs. You know, I try to get parents to understand that the medication is, you might have bypassed the problem on trying to just get them to feel comfortable. And I've gotten many people off Ritalin and off Adderall, all those types of things. So, yeah.
Wow. God bless you.
Yes, seriously. Well, thank you so much, Doctor, for being with us. Please let our audience know how they can find you, learn more about you.
Yeah. So I am HobsonInstitute.com. I do a lot of podcasts myself. I have the Breathing Lab podcast and I'd love to maybe interview you both too. So that would be really fun. So I do a lot of stuff for professionals and stuff for patients, but it's all airway related, breathing related. I will share with you the links if you want to connect with me online. I teach intro to airway courses for any myofunctional therapist, any dentist that wants to learn from a PT standpoint what I think is important to evaluate the airway and what to do to stabilize it. I teach that in the intro to airway course. I teach Rockabato headache courses.
Love it. I love it.
I am doing a lot.
Wow.
Yes. So I would love, I love connecting. I love speaking. If anybody wants me to speak anywhere, I would do it. I come and train clinics that want to implement these things, that want me to come to them. So I want to share this because I know a lot and I know how to help many people.
That's awesome.
But there's so many people that need help that aren't finding it.
Absolutely. And I can testify to you being a wonderful lecturer.
Oh,
and you know, if anybody is out there looking for this for their clinic, for just their knowledge, you to me are definitely the go-to. I can't say enough good about you. It was just, I learned so much more, and Yeah, you'll be seeing me again in the near future.
You'll be seeing me.
Yeah,
I'm like,
we'll have you coming to ICMO.
Yes,
So
I'm coming. Yes, I'm going to ICMO. I'll be there. I'm doing the pre-conference course.
Yeah,
I think in the afternoon, I believe, but I'll be there with aqualizers, with up blockers, so that you can experience it.
It's going to be
bring
great.
yours. Bring yours.
I will, because I'll need more training on that.
Yes.
Well,
Awesome.
and Priya, how's everybody find you again? We know, but you know.
Oh yeah. At the _TMJ _doc is my handle on Instagram and TikTok, and then I have a YouTube channel, and you know all the things. I'm like social media obsessed.
And I am PittsburghDentist.com. You can find me, and that's kind of about that's for every kind of platform that I have. So,
and if you want TikTok, I do like my little reminding things. TikToking things for airway breathing stuff. Hobson Institute. So join me on TikTok. I do that a lot, and Instagram too.
Love it. Okay. Thank you so much for joining us. I learned so much.
Thank you both. I look forward to seeing you in the future.